Our passion didn't start with the mouth. It started with people, with the well-being of the profession. And if you're like me, maybe a little bit of your nerdiness and all things tech too. We all want to love what we do, but the truth is, burnout, people problems, and glass ceilings can keep us from doing what we set out to do. So let's get back to the heart of connection. Welcome to the Dental Handoff. This show is about passing you the knowledge, the habits, the systems, and the strategies to lead your teams, lean on your tech, and listen to your gut while you take care of people and truly the overall health of our communities. Let's stop using the wrong end of the toothbrush, y'all. My name is Dr. Kelly Tanner. Oh, and uniquely, I'm a dental hygienist too. You can consider me a guru in the dental and leadership industry. With over 3 decades of experience, my goal is to take you to the next level by empowering growth, perspective, and confidence. By identifying the gaps, recognizing the plaque, and extracting the truth with the other experts in the field. I'll share their stories, empower you to own yours, and elevate your passion in the process. So have a seat in the chair, put on your bib, and let's get to work. Welcome to the Dental Handoff. I am Kelly Tanner, RDH, and today I have with me Dr. Sam Shamardi. Hi, Sam.
How are you?
I'm wonderful. Sam and I met, a year ago?
Yeah, about a year ago at this time.
Yeah, so we are at the Catapult Retreat in West Palm Beach, Florida. We just finished up our retreat. We're going to dine and have some cocktails this evening. And I've been trying to nail Sam down for about a year now because he's so busy. And he has such an interesting story. He's a periodontist and he does a lot of wonderful things. And he's passionate about some things that I'll let him tell you about. But Sam, tell us why dentistry and why periodontics?
Yeah, good question. I mean, dentistry-wise, the idea of helping people at baseline, not to sound corny, but true, that was a big motivation. Perio, I think the big thing was one, variety. I knew I kind of wanted to get into the specialty when I was going into my last year, but I didn't really know what. But I think just having the variety perio-wise, different procedures, and that's always good. And I think the other big thing is just the systemic link. I think nowadays it's become a lot more popular and people are starting to finally understand it and wanting to address it more. But that was always kind of a big motivation for me. I always thought of dentistry as being some preventative field and being able to address much bigger issues. Little did I know once I got into it that really wasn't the case. But I think it's, again, gaining a lot more steam now, and that was kind of a big motivation.
Awesome. So you also are very passionate about a few things. I know that you also have a faculty appointment. Tell us about what motivated you to be a clinician and then go back and teach, and then tell us about that experience and how it helps kind of inform what it is that you do every day.
Sure. I think, the clinic side, like I mentioned, with the patients and treatment and trying to make them better, that's big. But the faculty side is kind of a whole different side to it. I was influenced a lot by, teachers ever since I was a kid. There's a couple from elementary school that some of my childhood friends and I still try and visit, and we keep in touch, actually. Same through high school, same through dental school. So I always think of mentors that I had when I was a dental student. In fact, I just went skiing with them last weekend.
Oh, cool.
And mentor I had as a perio resident, and the influence they had on me was just so vast. They helped in so many ways. So for me, it was always an opportunity of thinking, if I can have a similar influence, even if it's a small amount, to some of the residents in a perio program, that would really be great as a way I give back. And that was kind of the motivation from the teaching standpoint.
So you're part-time there. Tell everyone where you teach.
Yeah,
Pretty cool.
Yeah, so I live in Boston, so a couple great dental schools there. I went to Tufts Dental School, but right now the teaching, I've been at the Harvard Perio Division for about now, believe it or not, it's been 12 years this year. I can't believe how long it's been, but fortunate to be in the postgraduate program with the residents. Really talented group. Everyone's, as you can imagine, very intelligent. Very motivated. They do a lot of incredible research, and they just have a lot of enthusiasm. So it's great to be a part of it.
So what is other than the clinical aspect of what I know that you impart with them, and try to tease out of the educational experience. Are there also soft skills and like other business skills and leadership skills that you teach them or that you all discuss during your time together?
Yeah, absolutely. It's a great question. I mean, I think one of the central themes with a dental education is that you learn a lot clinically. Unfortunately, you don't really learn much about the business. And that's a big issue. If you look at dental professionals, my own classmates, myself, pretty much all of our colleagues, the dentistry is never really the challenge. We all kind of learn enough and evolve enough once we go into the working world. But it's the finance part, it's the business part, it's the knowing not only how to run a business. And I as a periodontist work independently, but so I don't speak from a practice ownership standpoint. Obviously, I have a lot of colleagues that can provide a lot of great insight to that. But more just when you graduate, how do you set up your life? How do you go about trying to understand how to pay back your loans? Understanding your insurance options, why one versus the other, pros and cons, knowing about a corporation, what that means to you from a business standpoint, and just having those discussions, even just basic things like contracts, what to look for. So I'm able to just have in more of an informal way a lot of these discussions with the residents that have been going through the program, and that's really valuable because they come out and obviously they're anxious for the work. But then they're always not sure when they're looking for jobs. They're like, well, I'm being offered this. Is this good?
Yeah.
What should I be asking? What should I be looking for? And we don't have that preparation. So that's a big area I try and help out.
Yeah, it's and then too, outside of all the tactical operationalizing things, it's what about you now have a team to help and to support, like are they, do you feel that they're ready for that aspect as well?
Yeah, it's a lot that they really have to grasp. I think another theme we talk about is you have discussions about cases and literature and whatever it might be, but what they have to appreciate is that when you're in a academic institution, you're sitting around and working with like-minded individuals. They're all kind of on a similar level as you. They speak the same language, but the moment you step out into the real, out into the clinical world, nobody's on the same level anymore. You're speaking a foreign language, so you have to be part business and ownership, but you also have to be a people person. You have to be an administrator. There's just so many other angles that you don't really think about until you get there. And that's not even mentioning patient management and like the psychology that goes into trying to manage your anxious patients or your maybe your angry ones or whatever might be going on. There's just so much more that goes into it, and I think those intangibles can really make a big difference.
Oh, for sure. And then too, what I love to talk about is the technology piece of it that the practitioners are using to communicate with the patient, to allow them to understand the urgency of the care that you're seeing. And talk to me about like some of the new and upcoming things that you're finding that might be cool that other practitioners should know about.
Yeah, dentistry is such a technologically advanced field. It's a very entrepreneurial field, which is fun, but it's a lot to keep track of. So I think there's a lot of great technology that's come along the way in each category. I mean, you look at diagnostic, and we now have AI, and what a huge impact that's going to make over time. One of the companies that I work with that's been here at the retreat, Pearl, what they provide in terms of AI and just the identification of things that we oftentimes wouldn't notice or catch because we're so busy at the office. So what they're able to do is just off the chart. From a treatment standpoint, there's a lot of whether it's treatment planning software or just evolution in materials. How much being in the perio world, you think of implants and the advances in implant technology, the surfaces, the design of the actual threads. There's just a lot from that standpoint as well. And then maintenance. We think of surgery all the time, but we don't put enough attention into the non-surgical aspect of stuff. So stuff that I'm sure as a hygienist, from that world, you can definitely identify with. So, different types of technology, Perio Protect that was here, what they provide as a solution is incredible.
Yeah.
And even stuff as simple as, toothbrushes. People don't think about the advanced technology that we've seen now with mechanical toothbrushes, the IO brush from Crest, for example. There's just so much more that we never had this type of technology before, and these solutions can go such a far way.
And so as a practitioner, and you're making all these decisions, like what's the number one thing that you're looking for in a product or a technology when you make that decision?
Yeah, I think for me, any product or technology, obviously as a speaker, it has to apply to something that I do. So I have to not only think it applies, but I actually have to get my hands on it, or have some kind of experience using it and actually see the difference for myself. So otherwise, there's no credibility as a speaker to talk about something that you don't actually use or have some kind of experience with. So that's something big. But I think the biggest thing is it doesn't have to be something, radical. Obviously, a lot of them are in terms of what they can do, but you have to see that it's something that's really effective. You have to see it's something that really can make an impact for your patients. And a lot of it has to translate ultimately, not just into if it's going to make my job easier or better, but it has to translate into what it's going to do for the patient. Mm-hmm. Because ultimately that's who we're treating. So if we see that the patient is going to get some kind of a meaningful, change in their results, or even just overall in their experience, if there's a product that we can offer that will be, smoother or give them the, impression of having an easier experience or less discomfort or whatever it might be in that area, if we can help make our patient experience better, that in itself is already something that's worth it, because ultimately they're scared to see us. Yep. And especially in the perio world, that anxiety and fear is even that much heightened because of those words like, surgery and, blood and the post-op, pain and morbidity. So every little thing that can help minimize the patient, experience and make things better, that's another huge thing to look for.
Yeah, it's that benefit for overall health for the rest of the life, right, too, is what you're ultimately looking for. Yep. And of course that function that to making sure that they are understanding and also valuing what it is that that part of their accountability that they need.
Absolutely.
I think too. And then too, as something else I know you're passionate about is hearing loss.
Yes.
So tell us more about that, because this is something that I personally heard about, oh my gosh, was it 17 years ago? And I don't even know which event I was at. It was when I was a baby hygienist. And I was at this table and people were talking about the decibels and the sound. And I was like, no one's ever thought about that. So tell us what you know about that, because this is a pretty cool topic.
Yeah, unfortunately, I know a lot about it. It's been something I've been interested in and speaking on for about 10 years now. And it's something in dentistry that, unfortunately, we don't really address. Dental professionals, essentially, you can make the argument that through the course of our careers, we're basically going to develop some level of hearing damage simply because of the environment that we work in. So, hearing loss is a cumulative issue. And it happens if you're in an environment that's loud and if you're in that environment for a long period of time. So a lot of times people think, well, I might only be in the office for a couple hours a day and I might only be using loud equipment for a short amount of that time. But what they don't realize is that they're doing that consistently for a couple times, per week, per month. And then our average careers are around 35 years. So you start adding that up over this long period of time. And that's where really the problem comes in. So the unfortunate thing is we just talked about how much we've evolved as a field technologically, but when it comes to PPE, we've got all these, standards that we have on us. OSHA requires all these things, but nothing's been done to actually protect our sense of sound. So all these different products that are out there, or even gloves and masks, are there to protect, our hands or, our smell to some extent because of all the chemicals that we inhale, right? But when you think about your sense of sound, all this technology that's happened through the decades, nothing's ever been done to address that, despite the fact that we're right in the crosshairs of being in a field that causes us hearing damage. And hearing damage is permanent. So once you start to lose it, you're never going to recover. And the other difficult thing is you will never realize that you actually have hearing issues and hearing loss until the point where it's so advanced that now you're at the point of no return. So it's really analogous to dentistry. I tell patients all the time, we have that discussion with them about, you have a small incipient lesion or a little bit of an infection, and we're telling them to treat it, and they think, well, I don't notice anything and there's not a big deal. But then when they let it go and, they come in and they've got a huge abscess and the infection's so big, they've reached that point where it has to, be removed. It's a similar thing. By the time you then suddenly have interest and say, okay, now I'm ready to treat this, you're already past that point of no return. So that's kind of what hearing loss is. And unfortunately, not only does it affect our careers as dental professionals, but there's a lot of systemic health repercussions as well that get overlooked. It's directly linked to increased risk of cardiovascular issues, diabetes. For females that are wanting to have children at some point, it actually affects pregnancy and low-term, preterm birth weight. So there's a lot of direct evidence in the literature, and it's not something new. It's out there if you take a look. It's just not something that's ever been addressed for us as dental professionals, and it's something that really should be taken a lot more seriously.
What would you recommend a practitioner do to, one, be tested or to know if you're experiencing hearing loss? And then what can they do day to day to prevent that?
Yeah, I mean, unfortunately, our environment, it's not just, people always think of the dental handpiece, and that's just one part of it. But you think of the high-speed suctions, the ultrasonics, the lab instrumentation, pretty much most everything we use in our dental environment is contributing. So it's not like we can suddenly eliminate everything that we work with. Certainly, you can maybe improve on some of your equipment. Handpiece wise, for example, you can work with a company like NSK and go towards something electric. That's emitting much less noise, and that's great. But you still have the suction in the rest of the equipment there. So, point I'm getting at is the best thing you can do. You can't do a wholesale change of your office, but you can protect yourself with equipment. So. I developed about a decade ago, in conjunction with a hearing company, an electronic earplug that basically allowed us to still be able to hear our patients completely 100% HD, even though our ears are sealed with a plug. But the high decibel, high frequency noise of a handpiece or any other equipment would actually be lowered. So what that would basically mean is that we could be working in our environment 24 hours a day. And even though we could still hear the noise, it wouldn't cause us the irritation and wouldn't cause the hearing damage. So that's kind of the tip of the spear, is to look for this type of electronic or what they call active protection. That being said, there are other solutions out there. There are passive plugs that have little filters in there, like musician earplugs that they mold. That still helps for sure. And even if you were put foam in your ear, it's going to kind of cut you off from your environment a lot, but it's still effective as far as the hearing loss goes.
And I was just thinking about, the offices that wear the headpieces with the sound and the patient's ready enough. One, what are they finding because I was sitting there thinking that is in their ear all day.
All day.
So how does that affect it based on what you know from the literature?
Yeah, I mean, it depends obviously how often they're using it and how loud that volume is. Yeah. But, a lot of dental professionals will find that they have some hearing damage in the opposite ear from, whatever their dominant hand is or however they drill. It tends to be in that opposite side. Everybody varies. There's always a small genetic component to it. So there are some people that, tend to be a little bit more resistant than others. But really the bottom line at the end of the day is if you're a dental professional, it doesn't mean if you're the assistant, a staff member, obviously one of the doctors, hygiene, whomever it might be. If you are in the dental environment, you can't escape that noise, and you are going to be affected over the long term. So either you have to do something to protect yourself and protect your sense of sound, or with time you're putting yourself not only at, like I said, your sense of sound, but even your systemic health. You're putting yourself at risk.
Yeah. So would you recommend as a preventive measure that professionals, like especially dental professionals, go and have a screening for this?
Yeah, I mean, a hearing test is very easy to get, and it's something that we don't do enough of. The stats of, as a country and even as dental professionals is really low. The ironic thing is a lot of the major conferences, if you go in the back, you always see that they have trucks there with actual hearing tests. So a lot of conferences actually have it, but again, nobody ever thinks about it. And even if you see it, you think, what's this giant truck doing here? Like, I'm not going to go in there. So a simple hearing test can tell you a lot. We have to keep in mind that the hearing test won't identify that you have hearing issues until it's already become a lot more advanced. So it's still a very good thing to do from a screening standpoint. But even if you're in stage 1 hearing loss and you've started to lose a lot of your high frequency hearing, a lot of times those hearing tests still aren't going to be able to identify that. So, ultimately it'd be great to do, but the one thing you can do that's 100% effective is wear some form of protection.
Oh, that's so interesting. And I never knew that those trucks were there.
Yeah.
How would you know if they're there? Do they, I don't remember seeing that in the program.
Yeah, I mean, some of the conferences don't, but a lot of them do. And I think obviously the bigger the conference, the more likely it is. But obviously you could look in the directory and see. I know a local one by me being in Boston, the Yankee Dental Congress, we just had it last week. I don't know if they had it this year, but they had it there for years. So you'd be surprised if you start looking at a lot of these conferences do actually have it.
That's very interesting. Yeah. Okay, I learned that. I'm learning so much. So prevention is key. Get tested, and you're saying that with that, sometimes it doesn't even pick it up, but for a certain level, only
Correct.
until you're at level 1 hearing loss. Okay, interesting.
Yeah.
Okay, so switching gears a little bit, you've been a practitioner for how many years?
Going on, well, I finished residency in 2010. So yeah, 13 years in private, and obviously we had to treat patients for a couple of years during residency. So it's been a bit.
Yeah. So what would you say if you had to even say it was like your top 3 pieces of advice to people just about being a specialist or being a dentist that you wish that someone would have told you about? Like, you definitely need to go do this. Like, what would those look like for you?
Yeah, I think the couple main things is if you don't have a mentor, find one, because it's invaluable what they'll be able to help you with. It doesn't matter who it is, just somebody that you can bounce your ideas and frustrations and experiences off of. 2, I think really important is to have a good financial base. So, I did write a book for that purpose, trying to address that. And I'm not trying to say, you have to go buy that book, but any kind of advice you can get in terms of, like we talked about, knowing your options for insurance, contracts, the more of that you can learn, the better. So you can notice the first 2 things I'm mentioning aren't even clinical. So that's how important kind of that business side of things are. And then the third, I think, advice-wise, is just understanding that your first job isn't going to be your last, and that from a clinical standpoint, you shouldn't stress so much at the beginning in terms of how fast you do things. I think that's a big obsession. I see a lot of the residents even come and say, hey, how long should this procedure take? And it's like, that's not what it should be about. Focus on just doing the best job possible. With time and experience, you're going to get faster, you're going to get better and more comfortable. So I think those are kind of the bigger things I always point out.
Okay. What's the name of your book?
It's called The Financial Survival Guide for Dentists.
Okay. Yeah. I didn't know that.
Yep.
You're famous. Well, I knew you were famous.
No such thing.
Maybe infamous.
That more likely, but there's no such thing as a famous dentist. So anybody that says that is way off the rocker. So, but definitely trying to help.
Cool. Well, thank you so much. How do people find you?
Well, I'm pretty new to the social media game, but you can find me on there. It's just at Dr. Sam Shamardi. So that's probably the easiest way to find me. I'd give my cell, but that's probably not a good idea. So, but yeah, that's the easiest way. I have a website too, just drsamshamardi.com. And obviously through Catapult, I think that's another great way. Obviously something we're both a part of, and an organization that's incredible. It's helped us a lot, and the biggest source of education that's out there. So I think that's another easy way in terms of looking at where we are, what topics we're discussing, what new events are going on, that type of thing. So, but pretty easy to find.
Okay. Yeah. And then also too, you'll see Sam's information in the show notes for this episode, and the website for Catapult Education is catapulteducation.com. You can see all the speakers. We also provide product reviews as well. It's an amazing organization. So if you are an event organizer looking for speakers, they have qualified speakers just about on any topic.
Yep, literally. I mean, now we have a radiologist, obviously hygiene, endo, perio, and obviously general practitioners that have done and seen everything. So we've got an incredible team and a lot of variety to cover all sorts of topics, as we saw just from the retreat this weekend. We've got a great group.
Yeah, we sure do. Thank you so much for being on with us today.
Thank you.
And to all of our listeners, if you wouldn't mind doing me a favor, you want to give us a 5-star review on Apple Podcasts, and then also go to YouTube and like and subscribe and share this episode. Thanks for all that you do, and be well, and we'll see you on the other side.
Thank you.
Thanks, Sam.